Thank you for carving time out of your busy schedules to be here and to celebrate this important milestone with us. I would also like to extend a special welcome to our new county manager, John Eller. Day two on the job. John, thank you for joining us today and for being part of this significant moment in our community. Before we hear from these wonderful speakers, I would like to recognize a few individuals whose leadership and dedication helped bring this vision to reality. First, he's not going to like the fact that I'm recognizing him, but that's okay because we wouldn't be here today if it weren't for Michael Miller. Michael Miller is our design and construction director with Cabarrus County. He has been involved with this project from its earliest days. Michael, thank you for the countless hours, the partnership and collaboration, and the quiet, steady leadership you have provided throughout this journey. I don't even know where he is. He's probably hiding somewhere. But Michael, thank you wherever you are. I would also like to recognize Deputy County Manager Kelly Sifford, who has been a champion of this project since the beginning and helped guide it through many important phases along the way. Thank you so much, Kelly. And finally, Assistant County Manager Kyle Billifer. I hope he's here as well. Kyle was involved during the early stages of this project, stepped away for a period of time, but then came back to us last fall. And since then, he has been instrumental in helping us navigate the final stretch and bring this project across the finish line. So thank you, Kyle. While these individuals deserve special recognition, they are certainly not alone. There are countless others who have contributed their time, their expertise, advocacy, and passion to make today possible. In particular, I would like to acknowledge the members of the Mental Health Advisory Board who saw the need several years ago and helped us lay the foundation for today. So to every county employee, past and present, elected official, community partner, healthcare provider, advocate, contractor, the North Carolina Department of Health and Human Services, and resident who played a role along the way, we thank you and we extend our unwavering gratitude. This achievement belongs to all of you. So thank you all for your leadership, your commitment, and belief in what the center represents for the future of behavioral health in our region. With that, let's begin our program. So our first speaker is Commissioner Kenny Wartman, so I will invite him up to the podium.
My name is Kenny Wartman, one of 5 Cabarrus County Commissioners, and on behalf of Cabarrus County, I would like to thank all of you for attending today. I would also like to thank Commissioner Ian Patrick, who is here as well. And there are a lot of elected officials in the crowd, so if you happen to be an elected official or former elected official, can you please stand real quick so we can acknowledge you? And also, I'd like to take a quick second to thank all of our county employees who are here today and who have put this on, especially those who have been working the parking lot. We know it is not, it's not cool outside. It's kind of warm. So thank you for everything that you guys have done to get everybody into this location so that we could start. For those of you who know me, I don't typically write speeches down. I just wing it, which is what I'm doing today. Our communications department usually does an amazing job. Thank you, Jonathan, Dominique. Thank you, guys. But this was something that was so important to us, especially Mayor Steve Morris and I, that this is one I could speak from. So just by a show of hands, if you have ever needed help, whether it's to pay a bill, for gas, to change a tire, for mental health, if you ever needed any type of help in your life, can you please raise your hand? Any type. Okay. So personally, I've experienced with 2 out of our 5 children a mental health need. As a parent, it is not easy to deal with. As a parent, I felt like a failure. That's a lot of times how we look at that. But what I learned to realize and grew to realize is I wasn't a failure. I just didn't have the tools that I needed, and I wasn't equipped to handle that. But as a parent, to have to take your child to an emergency room and leave them and have them scream and cry that they will do whatever it takes to be better. Just please don't leave them. That's the reality of what we deal with as parents. To not know if your child's going to be shipped across the state, outside of the state. Those are real concerns. And if we feel that way, imagine how our children feel. They can't comprehend the way that we do. So to be able to have a location here in Cabarrus County that we can send our children to, neighboring communities to, I am so very proud of that. Everybody needs a hand up. There's always been a stigma of mental health is bad. It's not. Everybody here's needed help. All of you just raised your hands. This is our way to help those people. Sometimes it's long-term, sometimes it's short-term. But this is going to be the staple of Cabarrus County and the image of we're here to help. We're not here to look down on you. We're here to help, give you a hand up, not a handout. So with that, I know it's hot. Steve, you're up next. Elise is going to introduce you, but man, it has been an honor of a lifetime to name this building after you. The years of work that you put in, the research, the out-of-state, the out-of-town meetings, you were the driving force behind this building. So to be able to help name this after you has truly been an honor of my lifetime. So thank you.
Thank you, Kenny. Good morning, everyone, and welcome. Today is a day I've looked forward to for a long time, the day we officially open the doors of this new behavioral health center. Before I say anything else, I'm going to repeat some of the things that Elise has said because I don't think we can say thank you often enough. I want to take a moment to thank the people who made this day possible. The center did not happen by accident, and it did not happen because of any one person. It happened because a great number of dedicated people refused to accept that our community had to keep doing things the old way. I want to start in Raleigh, in the General Assembly. Former State Senator Paul Newton, former Representatives Kristen Baker, Wayne Sasser, and Kevin Crutchfield were all instrumental in securing the state funding that made this facility possible. Without their support in Raleigh, we would not be standing here today. I also want to recognize the firms that turned an idea into a building. The Human Experience, our architectural firm, did a marvelous job designing this facility, and I think you'll get a chance to look at that in just a little while. Messer Construction Company, led by Jason Harris, has been a valuable partner, not just on this project, but on projects throughout the county for years. On the county side, former county manager Mike Downs was instrumental in pushing this project forward from the very beginning, and he's here with us today. That vision was carried forward by Kelly Sifford, our current interim county manager, former deputy county manager Rodney Harris, along with Kyle Billifer and Michael Miller, have been involved every step of the way. Dr. Elise Pugh and Dr. Camilla McKissick have carried this work forward within the Behavioral Health Division. And of course, our county commissioners, both those serving today and those who served before us, have all played a part in getting us here. I'm going to resist the temptation to name each one of them individually because I know I would risk leaving somebody out. I want to also recognize Monarch, who will be a valuable partner in operating this facility, and every member of our Mental Health Advisory Board, whose work over the years laid the foundation for everything we're celebrating today. There are so many others who had a hand in making this day a reality, more than I could possibly mention from this podium. If I've missed you, please know it isn't for a lack of gratitude. It's simply because so many people cared enough to make it happen. To each and every one of you, thank you. This building stands before you because you showed up again and again for people you may never meet. And that brings me to something I need to say plainly. I am deeply honored, more than I know how to express, that this facility carries my name. A special thank you to Commissioner Kenny Wartman and the late Commissioner Lynn Shue for making that happen. But I want to be honest with you. That honor sits a little uneasily with me because so many others did so much of the work. My name is on the building, but their fingerprints are everywhere inside it. I accept this honor on behalf of all of them and hope every person who walks through these doors understands that this place belongs to the whole community that built it. Now let's talk about why we're really here. The services that will be delivered in this building are going to change lives in Cabarrus County. Not in some abstract someday sense, but starting now for real families in real crisis. Let me tell you what this means in practical terms. For years, if a child in our community was in the middle of a mental health emergency, their family faced a nightmare on top of a nightmare. That child would often be placed in the back of a law enforcement vehicle and driven miles away to a facility somewhere else in the state, sometimes hours away, while parents were left behind, unable to ride along, unable to comfort their child in the moment they needed comfort most. Parents would then have to get in their car and drive, not knowing what they'd find when they arrived, or how long they'd be there, or how they'd manage work, or other children at home, or the bills that don't stop coming just because your family is in crisis. That ends here. Now a family in crisis can walk through these doors together and get help right here in their own community. I also want to talk plainly about money because I think we owe that to the taxpayers of this county. One of the things that we don't say often enough is that this facility isn't just the right thing to do morally, it's the physically responsible thing to do. For too long, our community, like many others across this country, has relied on jails and emergency rooms as our de facto mental health system. When someone in crisis has nowhere else to go, they too often end up in our detention facility, not because they committed some act deserving of punishment, but because law enforcement did not have a better option. That comes at a real cost to taxpayers. The cost of incarceration, the cost of repeat encounters, the cost of a revolving door that never actually solves anything. Every time we can meet someone in crisis with treatment instead of a jail cell, we are not only doing the right thing by that person, we are saving the public's money. The same is true of our hospital emergency departments. Families in this county have watched loved ones, children included, wait for days, sometimes weeks, in an ER bed because there was no appropriate place for them to go. That is not care. That is a system with no good options, and it is expensive for everyone. The hospital, the county, and the family living through it. This center is different by design. It's what's called a no wrong door facility, meaning that no matter how a person arrives, no matter what door they walk through, they will be met with the right kind of help. Someone in an urgent crisis, someone who needs a short stay to stabilize, someone who needs an ongoing plan for their long-term well-being, all of it is here, under one roof, built to actually solve problems instead of just managing them. I also want to speak directly about something that touches nearly every family here today. Whether we talk about it openly or not, the crisis facing our young people. Across this country, the numbers are sobering. In recent national surveys, roughly 1 in 5 high school students report having seriously considered suicide. Nearly 1 in 10 report actually having attempted it. Suicide is now among the leading causes of death for young people in this country. Emergency rooms nationwide have seen a sharp rise in visits related to youth mental health crisis over the past decade. These are not statistics from some far-off place. These are our kids, our neighbors' kids, and our grandkids. For too long, if a child in Cabarrus County needed intensive behavioral health treatment, the nearest bed might be an hour away, 3 hours away, or simply unavailable, meaning weeks of waiting while a family watches their child suffer. This center changes that. It includes dedicated behavioral health urgent care for children and teens, as well as for adults, with separate spaces designed specifically for young people. So a 14-year-old in crisis is not sitting in a waiting room next to an adult in crisis, but is being cared for in a space built with their needs and their family's needs in mind. That is the difference this building makes. A parent no longer has to choose between getting their child help and getting to stay by their side. A family no longer has to drive hours to another county or another region, hoping there's an open bed when they arrive. Help is here now, close to home. This center represents years of work, beginning back in 2016 when local leaders first came together to form a mental health advisory board and to take an honest look at where our community was falling short. It represents a significant investment from the state of North Carolina and a partnership between Cabarrus County and Monarch to bring a fully integrated continuum of care, urgent care, crisis stabilization, and residential treatment for children and adolescents into one building built specifically for that purpose. But more than brick and mortar, more than square footage, more than any grant or budget line, this building represents a decision our community made, a decision that when someone we love is suffering, we will not turn them away, ship them off, or let them fall through the cracks. We will meet them here with care, with dignity, and with the belief that recovery is possible. To everyone who spent years fighting for this day, thank you. To the families who will walk through these doors in the months and years ahead, we built this for you. Thank you all, and congratulations to the entire community. Thank you.
Thank you so much, Mayor Morris, for those words. They were very touching. Next, I'd like to introduce Kelly Crosby. Kelly is the Assistant Secretary of the Division of Mental Health, Developmental Disabilities, and Substance Use with the North Carolina Department of Health and Human Services. Kelly?
That's such a very long name. Mr. Mayor, you're not a mental health professional, right? No, ma'am. I know he's not. I didn't think you were. That was a gorgeous speech. And you, sir, thank you for your speech, too. I don't know if y'all saw me. I was up here trying not to cry. Why? So you heard my title. My name's Kelly Crosby, and I should say this first. I work for the Department of Health and Human Services, and I bring you greetings from the governor's office and from our secretary, Dev Sangbai. It's a real privilege to be here today, and I came here just for one reason. I came to congratulate you all and to thank you. To thank you for what you're doing here for North Carolinians, what you're doing for your community. It's truly extraordinary. And your words, Mr. Mayor, were just truly extraordinary. How many of you have a family member with a mental health issue? I do, really close ones, my dad and my brother, right? And to hear someone who's not in the field speak with such understanding and compassion is truly extraordinary. It really is. That's not the norm. And what you've done here is not necessarily terrifically typical. You said, hey, right here on this main thoroughfare, we're going to build a beautiful building for families to bring their kiddos, for adults to come when they're in crisis, to receive humane, empathetic, sympathetic, high-quality, trauma-informed care. That's truly extraordinary. That's absolutely extraordinary, and it's such a privilege to be here with y'all today. I want to thank all the county leadership, the commissioners, the managers, all the elected officials here today, including the sheriff, our chiefs of police, all the county staff. I know folks are here from partners, from the local management entity, Monarch, the awesome folks at Monarch. There's other providers here. There's EMTs here. All of you are part of this ecosystem, right, of helping support your community. And I especially want to thank the people here with your own lived experience with mental health, with your family's own experience of lived mental health, and all of you that contributed to making this a reality. I really want to thank, I have to say this, it's true, and the mayor made such an extraordinary, he did such an extraordinary explanation of the financing of all of this. I want to thank our elected officials, and I want to thank the county officials for dedicating what we know are precious dollars into something this important. That doesn't happen every day across the state. That is an extraordinary commitment, extraordinary, and we're really grateful for that. And I want to say thank you to the other elected officials here for the money that you did give the department a few years ago. And we have been working at establishing more centers like this across the state. But y'all did this yourself. Y'all did this yourself. This is you all. And I'm here to congratulate you, to thank this extraordinary community for what you're doing for your community and for folks here in North Carolina. Thank you for being an inspiration. Thank you for being a hope for me and families like mine. Thank you for all the good work that's going to come out here. I really, really congratulate you all. Real pleasure to be here today. And I can't wait to come back again to tour this and hopefully bring the governor with me because he's loving these crisis facilities. So thank you all so much.
Thank you so much, Ms. Crosby. All right, as you all know, over 3 years ago, we underwent a competitive bidding process to identify an operator for this center, and Monarch rose to the top. So here next is Dr. Peggy Terhune, the CEO of Monarch.
Some of us are shorter than others. I'm Dr. Peggy Terhune, and I am so overwhelmed to be here with you today. I completely agree. Your speech was overwhelming. When we first heard about this project, oh, Cabarrus County's going to do something. Oh, yeah, you know, another county trying to do something. What are they trying to do? Well, let me tell you what they're trying to do. Oh, this sounds interesting. Let's find out more about it. And we thought, and we thought, and we looked at the program, and what they wanted was really unique. What they wanted was to start with letting kids and adults walk in the door when they were in crisis. Now, I have 7 kids of my own, and I fostered for about 20 years. And I can't tell you how many times I was at an emergency department with a kid that was suicidal or in crisis. And I said, wow, we want an urgent care where kids can come. Adults can also come. Because I experienced taking that one of my foster kids to the hospital where she sat for days and weeks. And finally she said, I promise not to kill myself. Can I come home? No treatment. Because you see, when you go to an emergency department, they're not allowed to start new treatment. They can't do it by law. So all you're doing is taking a child to holding. That's all that's happening. So what's going to happen here is you're going to bring a child here, And the child that you bring can stay in our urgent care up to 23 hours. That means they might want to sleep. We got that covered. They might want to eat. Okay, we can take care of that. They're going to need a thorough evaluation. And I said to my team when we were looking at this, I'm only willing to do this if we hire the best of the best. So we did. We hired the best of the best. We stole several people from other companies and hired the very best of the best to run this facility. So a kid can come in and stay, and suppose after 23 hours, they're not better yet. They can still stay. They can come into the facility-based crisis program, where they can stay for 7 to 10 days or longer if needed. That's the ideal time period, but we've had kids stay longer in the facility that we run in Charlotte. Sometimes DSS just can't get that placement that quick, or that foster parent will take the kid but not till they're back from vacation next week. So DSS and we are going to work very, very closely with these kids. And why am I talking DSS? Because as parents, myself as a parent, you never signed up to have that kid with mental illness. You don't know what to do. You think it's your fault. You absolutely think it's your fault, but it's not. Because mental illness is a disease, just like heart disease or like cancer. It's a disease. It's a disability that happens not because the parent is terrible or did something wrong or made the wrong choice about discipline. Mental illness happens. It's part of life. And as you remarked, it's a bigger part of life today. Why? We don't know. Maybe it's cyberbullying. Maybe it's the way kids are taught. In part, maybe it's because of the pandemic, when these kids were isolated and couldn't do what kids were supposed to do, work with friends. So the kid can come in, get evaluated, maybe stay 7 to 10 days, and then what? When I heard that Cabarrus wanted to add a PRTF, are the initials, Psychiatric Residential Treatment Facility, I said, oh gosh, have you seen what's in the news about that? I said, they are all over these programs. They are terrible. They take kids and they warehouse them. They don't treat them. They go to school a couple hours a day on the computer. If we're going to do a program like this, these kids are going to go to school and they're not going to come out of this program worse than when they came in or where they were when they came in. They're going to come in having passed the next grade. And people said, okay, we could do that. That would be all right with them. I said, we're really going to focus on education. They said, good. I said, and we're going to focus on treatment. We want these kids to get better. This is not a warehouse. This is not the place that you put the kid nobody else will take. This is the place where kids can learn how to cope. They can learn how all that depression that results in suicide attempts doesn't have to happen. There are so many other ways to manage your emotions and your terror and your trauma. I want to teach them that. Cabarrus County said, good. I said, okay, so they can go to school and they can get treatment. And I want everybody to be allowed to come. I don't want to have to turn kids away. And Cabarrus County said, we like it. I said, so we're not going to run this program the way other people in the state run this program. I hope you understand what I'm saying. It's got to be different. If my kid could end up there, I want this to be the very best place it could ever be. And Cabarrus County said, come on, we like the way you think. And that's how we got here. This is not going to be, for those of you that are used to it, your typical facility-based crisis or your typical PRTF. This is different. We also want to involve families. There's nothing worthwhile to helping a kid if they go back to the same situation and mom and dad still don't know what to do. I mean, gosh, you still have to hold kids accountable. You still have to tell them you have to do your homework, you have to go to school, you have to be polite, right? So how do we do that? We got to help parents know, when do you say, I'm sticking to my guns, and when do you not? So this is a community program. And I am so excited that this vision has become reality because the services provided here are not available anywhere else in the state. You can create new programs, Kelly, but this is going to be the best. Absolutely, hands down. I also want to say thank you because the vision Cabarrus County had was unlike any other county. They want the best. They weren't just finding a place to put kids. They were finding a place to provide treatment and solace. And when you go tour, my very favorite part of this building is there's these little cubby holes in the wall, and a kid can just go sit in this cubby hole. If I were a kid with mental illness, I'd want that cubby hole. I have a feeling they might fight over them. We'll have to see what happens. But this place it doesn't look like a hospital. It doesn't look like a treatment center. It looks like a cool place. It looks like a place I can get better, kids can get better, everyone can get better here. But here's the deal. It will only get used if you help us spread the word. We have an urgent care in Wake County, and it gets used, but only because people say, don't take them to the emergency department, bring them to the urgent care. If you don't do that as community members and as DSS and all of the different groups that are here today, EMS, are you sure you want to go to the hospital? How about I take you to urgent care? We will make sure you get paid for that, right? Right?
Yep.
That was a new change that happened in the state. Bring them here. Come here. Tell everybody, tell all your friends, tell everybody that you don't think they have a single problem in their family. Don't you remember going to church before you ever had kids, and you'd look at that family sitting in the front row with their 3 beautiful girls, and you'd think, oh, someday I want a family like that. But if you really knew that family, you'd know there are problems in that family because there's problems in every family. So you need to tell everybody, not just the folks you know that are struggling with a kid. Tell everybody about this center and tell them that the magic that they're going to find here is compassion. They're going to be treated with compassion. They're going to be treated as though they are sick, not as though they are bad. They are going to be treated as though they are people of worth and value. They're going to be treated as though their opinions count. That's not what they get everywhere. They're going to get that here. So I, like everyone else, cannot thank you enough. Your vision as a county, like you rank number 1 out of 100 in my book because you are it. You have done it. You've created it. Now we're going to show you how good it can get. We look very much forward to serving Cabarrus for many years to come. Thank you.
All right, thank you for those words, Dr. Terhune. Now it is my absolute pleasure to introduce our next speaker who has walked in lockstep with Monarch to bring the clinical and the operational planning to fruition. None other than our own Cabarrus County's Dr. Camila McKissick.
All right. Good morning, everyone. I meant good afternoon, everyone. Today isn't just about opening a building. It's about opening doors. Doors to hope, healing, and a brighter future for the people of Cabarrus County and our region. It is an incredible honor to serve as the Behavioral Health Director in a community that truly values behavioral health. That commitment is what made today possible. County leaders, state representatives, stakeholders, and so many dedicated partners came together with one shared belief that every person deserves access to compassionate, high-quality behavioral health care. The Stephen M. Morris Behavioral Health Center is a reflection of that shared commitment and proof of what is possible when a community comes together around a common purpose. This center also represents the heart of our regional No Wrong Door initiative. We believe when someone reaches out for help, they shouldn't have to figure out where to go while they're in crisis. Whether they call 911 or 988, connect with a provider, a school, law enforcement, EMS, or another community partner, every door should lead to hope, healing, and support. That is the kind of community we are building together. On a personal note, this day is especially meaningful to me. I was raised in a family where faith and service were simply a way of life, where we know that public service isn't just a profession, it is a calling. Those values taught me that serving others is both a privilege and a responsibility, and they continue to guide me every day. So I want to thank my family for supporting this calling with love, patience, and sacrifice. Finally, from the bottom of my heart, thank you to everyone who believed in this vision, who chose collaboration over silos, and who never lost sight of why we do this work. Thank you to Monarch for partnering with us to provide the services that our community so greatly needs. Years from now, people may not remember this ceremony, but they will remember how they felt when they walk through those doors. They will remember that they found hope. And that is the legacy of the Stephen M. Morris Behavioral Health Center. Thank you.
Thank you so much, Dr. McKissick. So as you've heard from many of the speakers, this center will primarily serve youth. And so we deemed it very important to have the perspective of a youth share some words with you today. So with that, it is my pleasure to welcome Mahira Jingran, who is a student at Coxmill High School.
Thank you. For years, teenagers across Cabarrus County have wondered why nobody was building something that saw them, something that understood what it's like to be young and deal with mental health struggles. Today, that question has been given a resolution, one that has a roof and 4 walls and takes shape in the form of this very center. Good afternoon, everyone. My name is Mahira Jingran. I'm a student here in Cabarrus County, and I've been working with my peers, Chetan and Bullup, to found a youth-led organization that shares the same mission as this facility, to construct a positive impact for individuals struggling with their mental health. Since 2012, a countless number of students, workers, and families have been plagued by mental illness, and were met with silence rather than support. This issue is outlined in our own State of the County Health Report, a report that heavily inspired me and my peers to initiate change. However, as teens, we have also been able to experience this issue firsthand and see how our behavioral health teams have worked together in order to construct a solution, influencing us to further devote time and effort into our organization, Teen Minds Matter, which was born through a leadership program called Skills USA. Teen Minds Matter has had the privilege of being able to impact hundreds of students in our area. Whether it was through presentations at local middle schools or social media campaigns, we have been able to raise student mental health awareness levels by 29%, donate over $1,000 received from door-to-door fundraising, and reach 76,000 people through online campaigning. Most of all, we were able to bring people together and have hundreds of peers show up for our cause at our numerous events, including community volleyball tournaments, appreciation card-making meetings, and more. The opportunity to make an impact has shaped the way my partners and I view mental health. If anything, we have further learned about the gravity this issue holds, highlighting that mental health is so much more than a statistic could ever sum up. It's something that impacts people with their own unique stories every single day and cannot be simply classified into a number or a category. This facility provides multiple unique pathways of help tailored to each patient's needs, ensuring that all parties involved feel heard. And after years of struggling, teenagers across Cabarrus County will no longer have to feel unseen, because all populations, whether it be other teenagers or behavioral health officials, have banded together and will keep working to do so in order to continue to build something that understands. Thank you.
Thank you so much for speaking so eloquently. All right, next we will hear from our architecture firm, who designed this gorgeous building for us. And for that, we have Sherry McRae Reyes, who's also been on this project since day one, even longer than I have. So,
I'm tall. Thank you. It is a joy to be here. I'm Sherry Reyes. Kevin Turner and I are the owners of Human Experience, and it's our joy to really design behavioral health programs and facilities all across this country. But this is different. This is special. We knew that from the first day we walked in, and we met with Kelly and Mike and Kyle, wherever he's hiding. We just knew when we heard the vision that this is going to be something special because they wanted to do all the right things for all the right reasons. And that's one of our core beliefs. Anytime we can partner with people that really want to do all the right things for the right reasons, like those are our people. And so as soon as we met with them, we just kind of sat down and we were ready to just dive in as deep as they wanted to go with all the conversations. And so it's been an amazing experience. We are so appreciative of Cabarrus County leadership and for securing county funding and state funding. I mean, I think it's amazing to not only talk about behavioral health as an issue in a community, but to actually do something about it with tenacity and grit. I think that's so special, and I wish counties across the country would do exactly the same thing for all the right reasons. Congratulations, and I applaud Monarch and the amazing team that's been assembled to run this facility with such integrity and excellence. They're going to be fantastic running this facility, and we're so happy to have worked with them through this process. Congratulations to Messer as well, who's really focused on all those fine details within a behavioral health space. Those fine details are essential for safety, security, therapeutic value, and the importance of an environment. And so everything, every person that's been involved, I just applaud everybody throughout this whole process. And thank you all for being here and showing that behavioral health is important to this community, and that people that need it so desperately, that are often marginalized within a system, can get true access to care in a compassionate, warm environment designed for excellence. So thank you.
all right, and last and certainly not least, Messer Construction representative who brought this building into fruition. So, Chris?
It's not lost on me that I'm the only thing holding you up from getting into the air conditioning, so I will try to make this quick. Good morning. My name is Chris Malinowski. I'm the Vice President and Regional Leader for Messer Construction, and it is an honor to be here today, celebrating the completion of this building alongside the county and our design partners. A big part of Messer's purpose as a company is to build better lives for our customers and our communities. And this project is a powerful example of that purpose in action. It means a lot to help bring this important resource to Cabarrus County because it is more than just a building. It's a place where individuals and families facing a mental health crisis can find immediate care, support, and a path forward. Construction of the 60,000 square foot facility peaked at more than 100 craft professionals on site, all working together to bring this vision to life. From day one, patient safety was our priority. The entire project team worked tirelessly to ensure that the quality of this facility is top-notch, resulting in a safe and restorative space for its patients. We're incredibly proud of what's been accomplished here and grateful to Cabarrus County for the trust that they've placed in our team. We've worked with the county for nearly a decade, completing projects such as the parking deck, the courthouse, and most recently we've begun renovating the buildings that are directly behind us for the future home of DHS. Congratulations to all on this lasting impact that this facility will have on Cabarrus County.
All right, thank you so much. Now the event that you've been waiting for, the actual ribbon cutting. I'm going to turn it back over to Dominique for some guidance and direction.
All right, another round of applause for our speakers today. That was awesome. Okay, so the moment you all been waiting for, like Dr. Pugh said, is the ribbon cutting. So I would like to have all of the folks that received information from me yesterday that you'd be participating in the ribbon cutting to come on up front. While they are getting staged here, I do want to kind of give you guys a run-up show of how the tours will work. So after the ribbon is cut, we're going to go every 3 rows, and you're going to go in with a tour guide. I'll highlight who your tour guide will be. And every 5 minutes, we'll take another row of 3 into the facility, okay? Do we have our ribbon cutters?